Okay. Good afternoon, everyone, and thank you for joining us today as we provide details of the Seniors Health and Wellbeing Plan. Seniors make up a significant portion of our population here in Newfoundland and Labrador, with approximately 23% of our current population aged 65 years or older. The percent of our population who are seniors is growing. While many seniors remain active members of their communities, some seniors do require more healthcare services as they age and more supports to age with dignity. We have heard seniors' concerns about accessing healthcare, the rising cost of living, and the ability to stay in their homes. And our Seniors Health and Wellbeing Plan lays out the ways that we will start to address the concerns that we've heard. In the past, our government has created numerous services that benefit seniors, and that's especially when it comes to healthcare. Some of these include creating dementia-inclusive environments in long-term care facilities, new long-term care homes in Gander, Grand Falls, Windsor, and Corner Brook, and a protective home in Botwood. Nurse practitioner positions to support the home dementia care program, funding for the Alzheimer's Society to provide dementia support and education to healthcare providers and the public, and our work to create centers of excellence in aging, including senior-friendly emergency departments and acute care of the elderly units at regional hospitals, which will lead to improved access to quality health care for all seniors in this province. These initiatives have been incorporated into our Seniors Health and Wellbeing Plan, but it goes further than that. We're introducing a greater number of supports to meet the needs of seniors. These include covering the cost of services such as snow clearing and grocery delivery for low-income seniors living at home through our new Aging Well at Home grant, helping seniors cover costs to repair and to modify their home through the Provincial Home Repair Program and the Home Modification Program, increasing financial benefits to caregivers who provide significant unpaid assistance to lower-income seniors who have complex care needs living at home as determined by a clinical assessment through the new $400 per month caregiver benefit, providing seniors 65 years of age or older with the enhanced immune response influenza vaccines, helping cover costs for food and heating for seniors living in coastal Labrador communities with an annual $500 supplement, and finally the expansion of the 211 telephone service. What all this means is help for low-income seniors with the costs associated with living at home. Applications for the Home Repair Program and the Home Modification Program are available now on NL Housing Corporation's website. NL Health Services will start accepting applications this summer for the Aging Well at Home grant. And for more information on the caregiver benefit, residents can speak directly to their case manager. Coastal Labrador residents aged 65 or older should ensure they file their tax return because some information, such as age and address, will be used to send out their supplement, and no application will be required. The Seniors Health and Wellbeing Plan is in addition to other initiatives to help seniors, including providing easier access to their personal health records through the My Health NL app, so seniors can more fully participate in managing their health, covering the cost of driver's medical exams for seniors aged 75 or older, including exams done virtually through Teledoc, and the Seniors Benefit, which helps almost 50,000 seniors throughout our province. I'll now pass it over to Minister Pike for a few words.
Thank you, Minister Hogan, Dr. Parfrey, Kimberly Leonard with Seniors NL, and thank you to everyone for being here today. As part of government's poverty reduction plan, we committed to a Seniors Health and Wellbeing Plan. I am very pleased to be here to provide more details about this plan today. As a government, we have a strong focus on seniors and older adults to help ensure that as we age, we remain healthy, active, engaged citizens living in age-friendly communities. As part of our Seniors Health and Wellbeing Plan, we are happy to announce additional funding for existing programs to support seniors in repairing and modifying their homes. The provincial home care or home repair program helps eligible residents to complete needed repairs, including basic heating, electrical, and plumbing. The Home Modification Plan provides forgivable grants and repayable loans to complete accessibility modifications such as ramp installation, roll or walk-in shower, and widened doorways. Funding for these programs has increased by $2.5 million, allowing them to serve more seniors, up to an estimated 500 senior households. The Seniors Health and Well-Being Plan supplements work already in place across government, including my department. The Department of Children, Seniors, and Social Development continues to support seniors' social engagement through the age-friendly Newfoundland and Labrador Communities Program, the Seniors Social Inclusion Initiative, and the Newfoundland and Labrador Transportation Program. My department is also leading the development of an intergenerational program guide that will help increase understanding and interaction between generations and challenge ageism. Great projects and initiatives to improve social inclusion and healthy aging are happening all over Newfoundland and Labrador through the leadership and innovation of the community sector. One great example that comes to mind is the Clarenville Region Extended Seniors Transportation, or CREST bus service. The CREST bus service began 10 years ago as one of the pilot projects under our age-friendly Newfoundland and Labrador Transportation Pilot Project. Since service began in 2014, CREST has provided approximately 21,000 rides for individuals to attend medical appointments, social activities, physical activities, to go shopping, and 38% of these riders currently have mobility issues. A remarkable thing about CREST is that it is completely operated by a framework of over 80 volunteers who schedule rides, drive the bus, and assist with helping customers. By supporting this type of fulsome approach to well-being, our government is helping to address the social determinants of health. Improving access to supports and services for seniors to age with dignity is a critical part of this approach. Our government is also committed to helping seniors with the cost of living. We've traveled across the province and around the province and have heard from seniors that this is very important to them, and it is very important to us as well. As Minister Hogan mentioned, through the Aging Well at Home grant, we are happy to cover costs and services such as snow clearing and grocery delivery for low-income seniors that live at home. Today, as part of this plan, we are announcing a financial supplement of $500 yearly for food and heating for seniors in coastal Labrador communities. In addition to this, our poverty reduction plan includes a targeted basic income pilot for people between the ages of 60 and 64, who are both in receipt of income support and services from Newfoundland and Labrador Health Services. I'm so pleased to say that we've now launched this project, and we have a number of individuals that have enrolled as the process unfolds. As Minister responsible for the community sector, I want to close by thanking those in the community who work to help seniors remain active and connected. Be assured that we remain committed to building communities that are age-friendly, inclusive, and accessible, which certainly benefits everyone across the lifespan. Thank you.
Thank you, Minister Pike. On behalf of Seniors NL, I'm delighted to join you today on the significant announcement of the new Seniors Health and Wellbeing Plan. Seniors NL supports, promotes, and enhances the independence and well-being of the people in our province. We are honored and privileged to work alongside of our seniors, their families, caregivers, volunteers, organizations, communities, and at all levels of government to ensure that our seniors are respected, valued, and actively involved in every aspect of society. Seniors NL have heard people express concerns about the rising cost of living, the complexities in accessing services, and the need for additional support to remain in their homes. We are actually thrilled to see our provincial government address these issues within this plan. As well, the introduction of the new Aging Well at Home grant, the caregiver benefit, and the Coastal Labrador supplement are highly welcomed, alongside the continued seniors benefit, as well as increased funding for both the home modification program and the provincial home repair program. This new Seniors Health and Wellbeing Plan adopts a comprehensive and inclusive approach in addressing the challenges and diverse needs facing the seniors in our province. At Seniors NL, we stand with our government on this remarkable initiative, and we are committed to doing our part as an organization to support and promote it. This will be done through our many partnerships, the programs and services, including elder abuse prevention, social prescribing, collective impact, and information and referral. So together with our government, we look forward to our continued partnership and commitment to further enhance the independence, health, and well-being of all seniors in Newfoundland and Labrador.
I'm next. And you know my job is to talk about how consistent these endeavours are with the Health Accord. And as you know, we are the oldest population in Canada. Nearly a quarter of our population is over 65. We have rudimentary geriatric services. And geriatric services are so important because seniors have a different set of problems and a different approach to these problems than people that are younger than 65. We have a dependence on institutional care for long-term care, but there is a demand for aging in place interventions. So the calls to action from the Health Accord involved 6 different things. They involved age-friendly communities, aging in place, improved quality along the continuum of care from the community to the personal care home to the long-term care home to dying. It demanded community approaches to managing frailty and preventing frailty, and recommended centres of excellence, 3 of them in the province, that related to the provision of geriatric care with outreach to other hospitals and communities. So with these announcements, I think that we can demonstrate that those tenets have been matched by, at least we've started to match those tenets with interventions. The Healthy Aging and Dementia-Friendly Communities, Aging Well at Home grant, caregiver benefit, an approach to home first when you leave hospital, strengthening the home support program, improving the home repair and modification for seniors so they can stay at home, a geriatrics-informed approach in the community with family care teams, and a geriatrics-informed approach within hospitals, particularly with acute care of the elderly units, age-friendly emergency rooms, restorative care, and rehabilitation. So I think with this start, we're now embarking upon improving the lives for seniors across multiple arenas that are important.
Parfrey, you described this as a good start. What do you think has to happen next?
We've got to continue to invest in all those areas that I mentioned, because the whole idea of healthy aging, preventing frailty, managing conditions associated with frailty in the community, allowing people to age in place, helping with home support, all of those things are going to require further investment as we go along, because the population is going to get older. And as we invest, we learn how best to be able to handle these various issues in this province and hopefully improve them as we get experience about what we're doing. In particular, with the Centres of Excellence in Aging, we've got to recruit more geriatricians, we've got to recruit staff that are capable of being able to provide the type of care that people need as they're recovering from an acute illness. All of those things take time.
Is there an immediate problem you think needs to be addressed?
Well, I think these interventions are all about trying to deal with the immediate problem. And they are consistent with a $45 million investment in the seniors framework.
Question for Kimberly. You know, you mentioned some of the concerns that you've been hearing over the years from seniors. What sort of a difference do you think what was announced today will make in terms of the concerns that you've been hearing?
I think it will be very supporting for elders and seniors throughout the province with this plan. There's a lot more in this that seniors can avail of by going through the programs, and the programs are going to be made accessible so that all seniors can access them. And I think it can only enhance the cost of living for them and help them to deal with the rising costs. So I really think that this plan is beneficial in helping and addressing that issue.
There's a lot within this plan. Is there any one initiative or program that you're particularly happy to see in there?
Well, I'm really happy to see about the new Aging Well at Home grant. We get a lot of calls at that at Seniors NL because aging people want to stay in their homes. And if there's a way or something that they can access, an application and, you know, a program that they can access, it's making them happier, and they're going to be more apt to try their best to get to stay in their home. And in the end, it makes people well and gives them something to look forward to.
So for seniors who are already out of their homes, who might be in a long-term care facility, I'm curious, is there talks or conversations about bringing in benefits for them at some point?
So this is a targeted approach right now for these individuals that we mentioned. Of course, we're doing a review of long-term care homes, and that will include anything and everything about what individuals who live in those facilities need on an ongoing basis and in the future. So I think, as Dr. Parfrey said, you know, no more work needs to be done. This is a start right now. This is $10 million today on top of another $35 million that we've talked about before. But we're just sort of scratching the surface, and it is a targeted approach today for those individuals who can and want to stay at home. Particularly, look at the $400 a month for eligible caregivers. You know, that's a lot of money for someone who is providing that care right now free, and that money will help that person provide that care to individuals who then won't have to go to long-term care homes. So we avoid having to deal with issues that might arise in the future for people who do have to leave their home, which we don't want and which they don't want. We want them to stay in their communities. And that money is specifically to avoid that transfer to long-term care facilities in the future. So, like I said, targeted approach. Great start here today, continuing on the work that's been done, but very clear that, as Dr. Parfrey said, this province continues to age. We need to continue to do further work as well.
You mentioned there was $10 million on top of the $35 million. So is there $10 million of new?
This is $10 million. The packages that we announced today, the $500 for coastal Labrador, the $400 a month for caregivers, the $400 grants for individuals who might need it for snow clearing or grocery delivery and things like that. The total of that we anticipate is going to be about, and again, the flu vaccines and the expansion of 211, that today is about $10 million. And sorry, and the home repairs as well.
And that wasn't announced in the budget. This is
So it was a budget, you know, placeholder, I guess I'll use that word, and these are the details of that money that was. So it's not new money in terms of increase to the budget or anything like that. Yeah.
So, Minister, if a senior stopped you on the street, it's a lot to digest today, and they said, how does this help me? What would you say?
You know, so I feel like when a client comes in as a lawyer, you'd say, well, you need to tell me a little bit more details about the issue. But, you know, I would ask them and say, you know, what are you struggling with? Where do you need help? And I would say, having heard, you know, the Department of Health and Community Services have talked to a lot of seniors throughout the province, and this is what we've heard. These are the supports that they need in the immediate right now to help them continue to stay at home. So I would assume if I talk to a senior that they're probably going to raise these as issues. You know, things like, I can't go out and shovel my driveway in February. Couple $100, $400 grant will help me do that. So I don't need to leave my home. So I don't need to go somewhere for assistance. So I don't have to make a choice between heat or shoveling my driveway or groceries, you know, et cetera, et cetera. You know, that grant right there, I'm sure I would say to them, that's going to help you get through the winter or get through other issues that you might have. And someone with more complex needs, who has a family member who might be helping them out, It's a lot of time and effort for someone who has to look after someone with high care needs, a senior who's at home. And I would say we as a government want you to stay at home. We want you to age in place. We don't want you to move out of your home, and even worse, move out of a community where a lot of Newfoundlanders and Labradorians have been their whole lives in small communities throughout this province, and they want to stay. And who are we to say, no, you have to leave? We want to help them stay. And I would say that I bet you that if I talk to a senior, that those couple of things are going to be first and foremost what they talk about. And I would happily be able to say, look, we have some programs now that can help you stay where you want to stay.
Yeah, and if I may, we've been out meeting with seniors in the province, and what the things that we hear, like, are of course centered around cost of living, but we're also hearing is aging in place, aging at home, aging in their communities. And we get that, and that's the programs that are announced today will help that. A lot of seniors are living in homes that may require renovation or home repair, and we certainly are very much interested in helping our seniors remain in their communities and remain at home through for example, our age-friendly program. A lot of communities have done some great work. I have living in the rural part of the province. I get an opportunity to see some of the projects that communities are doing to keep people, keep our seniors at home, to let our seniors socialize and so on. And I'm very impressed with the number of intergenerational activities that are taking place as well, as that seniors and youth are getting together. So it's great.
Right.
It's clear that people do want to stay at home, and it sounds like these programs will help them do that. But is it also partly motivated by the fact that providing care in an institution is very expensive? And does this make sense in terms of not having to spend a whole lot more money on people?
Look, we spend a lot of money on healthcare in this province, as everybody knows, and I think the focus on that is making sure we get value for every dollar that's spent. But at the same time, the priority is very clearly to allow people to stay in place and age at home. There's a cost to that. We're contributing a little bit to that cost here today. It's not healthcare at any cost, but it is making sure that people are happy and we are delivering the healthcare and services that they want, as opposed to what it might cost.
How important is it to have a plan in place now while the population of seniors is at like a quarter of the overall population? In the tech briefing, we were told we'll get up to almost 30% in the next few years. So how important is it to have this plan in place now?
Yeah, again, I just go back to where I say this is a start, and demographics change, our population changes, society changes, so we need to start somewhere, and this is a start right now, but again, this is not the end. We'll continue to evaluate, we will evaluate how these programs work, and we'll evaluate what else, if anything, is needed on top of them, and what will change in the next year or 2 or 5 years. Again, we're always in constant communication with seniors throughout the province on the issues that they face. I'm sure we'll hear from them if there's issues that arise, and we look forward to that. We always look forward to collaborating and hearing what the issues are, sort of from a bottom-up approach as opposed to a top-down approach is the best way to deal with these issues.
I have one last question, if I could ask you. So I get you over. You're clearly pleased with this plan, but is there something you think that's missing? Is there something else that needs to be done next?
I think every big initiative starts somewhere, and I think this is a really good roadmap to get us to where we need to be with seniors. At Seniors NL, we are hearing, the rising cost of living, and housing is involved with that, and then there's income, and the poverty is creeping up there, and we also hear from a lot of seniors who don't want to go to long-term care facilities, and they're trying to find ways not to go. And I think what we're doing here in this plan is a great start, and I think it gives us something to build on. So it will be reevaluated and revisited, and I guess we will just make accommodations as we go, but right now it looks like to be a really good plan, and even with the new Aging Well at Home grant, I think that's very crucial, along with the caregiver grant, because not all family members, like people find, in order for people to stay in their home, they need help and they need caregiving. And with a caregiver benefit, I think that makes it easier for people to find. And I think in that respect, the plan is off to a really good start.
Thanks, everybody.
Thank you.